Many people ask me with the work that I do with children to explain the details of how cranial problems and how misalignments of the spine can affect the different things that we see with babies and how adjusting can affect that. So what I do is just make a couple basic explanations for you as you watch this. Now, this is supposing you understand that the idea of what's called a subluxation or a misalignment of the spine can occur, particularly in the birth process. The idea when a baby is born, the doctors oftentimes will do a procedure where they are clearing the shoulders and they're pushing down on the edge of the skull. As they push down, this bone called the mastoid process is developed, so it's right at the atlas, and that can cause a misalignment or put stress on the upper neck spine. That misalignment then, if the body can't clear it out on itself, then creates an interference. So with a misalignment of that top vertebra called the atlas will misalign. With that then goes a purple bone on here. This bone here is called the occiput. It's at the base of the skull, but the occiput then will also misalign. The big hole that is in that occipital bone is where the base of the brainstem is, respiratory centers, those types of things. So there's a misalignment of the atlas that affects the occiput. Well, connected to the occiput, the purple bone, is a yellow bone here. That bone is called the sphenoid bone. That sphenoid bone makes up the back of the eye sockets. And this is where you'll see babies where they have one eye bigger than the other, that type of thing, where the pup eye, where they'll open one eye when they first look at. Sometimes it'll balance out, but many times you'll notice you'll see more white around the color of the eye on one eye more than the other. That's with the sphenoid bone. Now, also attached on the back side of the sphenoid bone, there's these two little hooks that are right here. Off of those bones, coming up here to the soft palate, is muscles that help regulate the soft palate. That musculature, then, when you have an atlas, occiput, sphenoid misalignment, the sphenoid goes off, it affects those muscles that are on the back of the soft palate, and that will make a baby that is easy to gag. When you go to nurse, they'll spit it out, but they want it, so they'll pull it back in, but they gag and spit it back out again. That will end up stripping the nipples of the mother and making for bleeding or sore nipples or breast on that woman. Many times then, those babies will also favor one breast than the other. And I also joke that babies don't favor a breast. There's not like one side makes vanilla and one side makes chocolate. They both make the same thing, so a baby should have nursing experience equal on both sides. What that comes from many times is because of the misalignment of the upper neck that affects the occiput and that sphenoid. That will cause a baby to have a head tilt. Okay, so instead of the head being level like this, it'll tilt to the side. With the tilt comes rotation. So for the baby, when it has that head tilted and rotated, that takes the stress off of the neck, off the subluxation, and they're fine. If they go to put their head straight or square, it puts more stress on all of the structures. They don't like it, they cry, so they tilt their head and have it rotated. That is what will cause these babies to develop flat spots on their skull, because they're always having their head tilted off to a side. It can start developing a flat part on the skull. The other part with that is when you have that baby that is the tilted and rotated, when they go to nurse on one side, it will be easy and comfortable for them. Well, when you have to go to the other side, their head has to turn the opposite direction, and it makes it difficult. So they will pull off, and that's again where they will pull the nipple and strip the nipple as well. The other thing that's important with this, and it's harder to see on the skull, but inside the eye sockets, there's a yellow bone connected that goes this white, and then this purple bone. Well, there's an opening right here that is the drainage for the lacrimal duct. You'll get babies that will have a clogged tear duct because of this atlas, occiput, sphenoid affecting these other bones, and you'll see a chronic congestion of the lacrimal ducts. Also, that comes off the connection between the occiput and the sphenoid is there is openings for the cranial nerves. One of the nerves that comes out of there is the vagus nerve that will go all the way down into the small intestines. It can have effects on the small intestines and also gut and digestion and the valves associated with that. The other aspect of this too, again, misalignment of atlas with the occiput, with the sphenoid, it connects to the aquabone, the maxillary bone that's here, that will also affect in terms of having babies that have a high palate, that are noisy nursers. So when they nurse, you hear they suck and they make a lot of noise because they're losing suction and they get a lot of air and they get gassy. So all of these pieces are all connected, from the atlas, the occiput, the sphenoid, and the other cranial associations. The beautiful thing about being a KST doctor is allowing us to look at all of those aspects, looking at misalignments of the atlas. Is it a cranial issue? Can it be adjusted for the cranials? Is there also soft tissue issues involved as well, directly with the valves, and with babies that spit up, that are colicky, they're crying all the time? Well, babies, the only way they have to describe that there's a problem is they cry. So if they're having a chronic stress somewhere in the area, all they can do is communicate to you that there's a problem. I hope that this will help you understand a little bit more clearly the issues that you may see either with your baby, someone else's baby, or doctors that are watching this, the babies that come into their office, and be able to look at and address and realize that a chiropractor that works and specializes and has a special interest in doing pediatric work, and particularly with KST work, to be able to address all these issues and see them resolve very quickly and very consistently. We get many referrals from lactation consultants that their babies are struggling. When they come in and we address these underlying issues, they improve so much faster. It's just the way it is. So if you have any questions at all, I would encourage you to contact a KST doctor in your area. My name is Dr. Kevin Ross. I am in Tempe, Arizona. I also work with pediatric and pregnancy care, as well as all other ages and ranges of folks, but I also am a KST doctor as well. Thank you so much for watching it. I hope this helps you, and we can have many, many more healthy, happy, nursing babies and moms that can successfully breastfeed because they're addressing the underlying issue of what happens with the cranial system. Thank you so much.